Okay, good afternoon. Thank you all for joining us today as our Brookings Mental Health Task Force reports on the work that we've done over the last 2 years, the survey results, and some recommendations that we have for the group. We're going to start with some introductions of our task force, give you a little bit of background on who we are and what we've been doing with the task force, and then we'll dive into the presentation. As you'll see, we go through the presentation. We've got quite a bit of information to get through. So we'd ask that you hold questions until we're done with the presentation itself. And then we'd love to have just open dialogue and discussion, any questions from the audience at that time. So my name is Mary Beth Fishback. I am one of the co-chairs of our mental health task force. I am currently the program coordinator for the Master of Public Health program at SDSU, as well as the interim executive director for East Central Behavioral Health. Craig, we'll flip it over to you at the end.
Craig Paul. I'm the president of the Brookings Empowerment Project, and I'm a member at large.
I'm Nikki Eining. I'm an outpatient therapist with Avera Behavioral here in Brookings, and I'm also a co-chair.
I'm Sylvia Bubaltz. I am the district supervisor for the Division of Rehab Services here in Brookings. I'm also an adjunct professor for the Counseling and Human Resources Development program at SDSU.
Hi, I'm Andrea Bjornstedt, and I'm an assistant professor at South Dakota State University in the Department of Counseling and Human Development, and I also serve as the mental health specialist in SDSU Extension.
Angela Boersma, Brookings County Commission.
Deb Debates, and I'm representing the school board. And I'd like to share too that Randy Grimsley was on the task force prior to my election a year ago. So between the two of us, we've been involved from the beginning.
My name's Dan Hansen, and I am the City Council representative to the task force.
Okay, Andrea is going to start us off with just some background information and keywords to give us all some perspective.
Okay. It's important to differentiate between some of these terms because a lot of these terms are thrown out and used interchangeably, but they definitely mean different things. So I'm going to skip around on this slide a little bit. I'm going to first start and talk about mental health. And this is really, everybody should strive for positive mental health. So it's actually your state of well-being in which you realize your potential and you can cope productively. Woo, can't talk. So mental health, we're all striving for positive mental health. Mental illness is a diagnosable medical condition, so you have to meet certain criteria. And it's a wide range of health conditions involving your thoughts, your cognitions, your emotions, and your behaviors. And so a step up from that is serious mental illness. And this is where the mental illness definitely impairs, it's serious functional impairment. So it interferes with one's ability to manage life. And then behavioral health kind of encompasses all of those different things. It encompasses both mental health and substance use disorders. A little bit of a background. Nationwide, 1 in 5 adults experiences a mental illness. I've actually seen statistics that suggest 1 out of every 4, so it kind of depends on where you look. Depression is the leading cause of disability worldwide, and it obviously carries some great burden. 90% of those who die by suicide have an underlying mental illness, and suicide is the 10th leading cause of death in the United States. So let's talk a little bit more about South Dakota, though. More than 30,000 adults and 9,000 kids live with serious mental health conditions, and this past year, in 2018, we had the highest number of recorded suicides ever reported in South Dakota. And so it is the 13th highest suicide rate in the United States South Dakota has. And when I go and present, I talk about how it's not something South Dakota should be proud of. It's something that we should really be working on. The highest risk is with our males and 18 to 24 years old.
So now that we've gone through the background, it'll be really the setting point as to why we were developed as a task force to begin with. Now, as Mary Beth had mentioned at the beginning, we have been doing this process for a little over 2 years now, but our main purpose essentially is to complete a comprehensive needs assessment, to create a roadmap of services currently available to the mentally ill, and to propose improvements to the current services available to people with mental health issues in our community. Now with that, as we go through our presentation today, we will go through each of the objectives and how we've been able to accomplish and how we've moved forward with each of those objectives. But as part of the charter, we were tasked to complete them, and they include identifying and investigating what resources are available to someone struggling with mental health issues, determine the prevalence of mental illness in the county, explore what needs currently exist, and then also provide a venue for collaboration and communication. And as we move forward, we will identify each of these areas.
The Brookings area mental health guide was actually a pretty quick hit for the task force. I think within about 6 months of the task force forming, we recognized that we had some level of services available in the county, and we wanted to at least make that available to everyone in our county. So through a collaboration with United Way and 211, we were able to put the mental health resource guide together and get that operational. In 2018, we had about 249 people access and download the resource guide, and so far, year to date in 2019, we've had 101. So we know that the resource guide is being utilized, and we get positive feedback. I mean, we don't have all the resources we need, but at least the ones that we do have are identified. I think one of the recommendations then that you'll hear us summarize for us is that we continue to fund and support the resource guide through our funding of some of the United Way requests from the city and county.
Thanks, Craig. Okay, the next objective for our task force was to determine the prevalence of mental illness and explore what needs currently exist in our community. So this was done. Our task force developed and implemented a mental health specific community needs assessment survey. This data showed us perceived gaps within the mental health services in Brookings County and gave us some areas to focus when we're looking at our recommendations. As I progress through the slides, the recommendations will come with each area that we've identified as a specific gap. Just a little background on needs assessment methods. This is a form of community-based participatory research. We had an online survey, which the way we developed it, we were able to gather both quantitative and qualitative data. And then we had some additional focus groups that provided us some ancillary qualitative data that we were able to utilize. So what can be achieved by a mental health needs assessment? It really gives us an opportunity to look at the mental health challenges that are within a community, gather additional information to help guide improvements on services, and that information is really coming from direct feedback from our community members, and then help support effective collaboration and communication among the providers to identify and address those areas of unmet need within our community. I just wanted to highlight quickly some of our survey demographics. Again, it was an online survey. We utilized Question Pro. The survey was live from September 1st to October 23rd, 2018. Our target population was the residents of Brookings County, and we had 331 individuals complete the entire survey. We do have some percent breakdown here of additional demographic information. The majority of respondents were female, age 25 to 55, white or non-Hispanic, live in the city of Brookings, and their primary and use private insurance as their primary payer for mental health or substance use services. We also looked at employment, education level, and household income. You'll see, again, the majority of the respondents had a bachelor's level degree or higher, employed full-time, and with an annual household income of greater than $75,000. So just by looking at this demographic slide, it's very clear that there are some limitations to this study. Number one, we had a fairly low response or completion rate. In some upcoming slides, I do talk about the number of individuals that completed a particular question, so whether or not they made it through the entire survey. We do have data on specific questions that is helpful. The other area to note is that what we're seeing as far as demographics does not actually mirror Brookings County population. So, we're clearly missing some important population groups within this survey data. So what we did to help address that was, again, have some focus groups and try to do some targeted questions to those groups that we may have missed. But again, our task force acknowledges that this was a major limitation to the study, although we don't believe that there would be any change to necessarily our findings or the recommendations that came out of this work, but just something to acknowledge as a limitation for us. So I'm going to preface this by saying you're going to get to hear a lot of data from me in the coming slides, so bear with me. And this data, so again, as part of this work, we did the online survey and we did focus groups. So we had some quantitative analysis. The qualitative side, we really looked at doing a thematic analysis. So we took verbatim responses from community members, whether that was through a focus group or through their direct responses to our online survey. And we did some thematic analysis on that to provide the information that we have here. So after the demographic information in our survey, the first question that we asked was for people to self-identify where they felt they fell on the need spectrum. So our respondents were asked to categorize themselves based on need, currently in need of mental health services, currently accessing mental health services, a family member of someone needing or accessing services, or none of the above. What we wanted to show you here was basically grouping those in categories needing or accessing versus not requiring service at all. And you can see it's kind of close to 50-50 there. The blue part of the graph is our requiring access to service, and the red is the not requiring. This is one of the higher response rate questions, so we did have 690 individuals complete this question. Again, based on analysis of the survey and focus group data, we were able to identify some perceived service gaps in Brookings County. So the gaps that we've identified: lack of mental health care professionals, so in terms of counselors, psychiatrists, psychologists, et cetera, anyone that would be considered a mental health care professional; affordability of services; crisis support; substance abuse services; and then school mental health services and mental health care for children and adolescents. We have not prioritized these in any way. So we'll report basically from top down, but that's not a priority listing. It's just the identified gaps that we have noted. So we're going to start with one of the largest areas that we have data about, and that's the lack of mental health care professionals. So again, we asked this question in several different ways within our survey and in our focus groups. This slide represents reasons that people were unable to access care in Brookings. So when asked, when respondents were asked if you sought counseling services in the past year but were not able to see a therapist right away, what was the reason? And this again was a select all that apply. In one of the largest sections with 36.6% response was that no appointments were available when they made the attempt to access services. When asked a different way, what barriers do individuals currently experience when trying to access services? And by far the highest response rate to that was lack of personnel or availability of appointments. And again, asked it in a slightly different way. We asked about individuals that chose to leave Brookings County to receive their services. And if they chose to leave, then why they chose to access those services outside of Brookings County. And again, overwhelmingly, the response was lack of personnel or availability of appointments was a primary reason that they chose to access services outside of Brookings County. I realize this is a full slide. I'm not going to read it verbatim. But again, as I mentioned, we did some narrative responses as well as focus group questions. So these are direct quotes that are coming from our community members about the availability of appointments. And again, this did rate kind of number one on the reasons for accessing mental health care outside of Brookings and as being a barrier to service. So when asked if I or my family member were able to access all needed behavioral health services in Brookings County, there would be, you can see by the quotes, more licensed counselors, more professional psychiatric care providers, inpatient treatment options. There's a lack of access to psychiatrists, psychologists, affordable treatment, and options outside of essential behavioral health. Many services must be obtained in Sioux Falls, which is already overburdened with patients. And then we would have more therapists or counselors in the area. Appointments are often booked full at East Central, even worse at SDSU, and we need more counselors. So again, these are direct quotes that are coming from our community members on what they perceive related to service availability. So our recommendations related to addressing the lack of mental health care professionals, we've got 4 primary recommendations. The first one is additional funding and support for the Community Mental Health Center of Brookings County to allow for the hiring of additional counselors and expansion of services. Additional funding and support to increase school-based mental health services. We've got a separate set of slides that cover all of the school-based services, again, because this was one of the primary identified gaps in services. So more details will come on that recommendation. Support for expansion of triage services via Avera Behavioral Health, and then consideration of a centralized referral service to help ensure full resource utilization of all providers locally. Affordability of service was another area that was identified as a challenge with survey respondents. This, I just wanted to show 2 separate pie graphs here looking at affordability of mental health and substance abuse services. On the left, we see all responses. So this question was set up as a yes, no, or not sure. On the right, we just selected it down to responses that had a definitive opinion. And again, overwhelmingly, people do not think that mental health and substance abuse services are affordable in Brookings County. Some of the direct quotes, again, related to affordability of services. While there is a lot in Brookings for support, financial means is the biggest concern that is seen. Even with insurance, it can be expensive to meet the need with someone just to keep yourself in a livable place and work through things, even if you only meet once a month. And then if I or my family member were able to access all needed behavioral health services in Brookings County, there would be more insurance coverage for more affordable services. Through Dakota Care, there's only 5 covered counseling appointments, and after that, it was no longer affordable. These really highlight, again, we chose quotes that kind of summarized the theme of what we were seeing related to affordable services. And again, consistently, people were saying that even just to have regular kind of maintenance appointments, once every couple weeks, once a month, it's not affordable, let alone if you may be a higher need and someone that needs to see a clinician on a more regular, say, weekly basis, the finances become even more of a limiting factor. Additionally, just identifying that insurance coverage for individuals that have insurance, maybe the coverage for mental health and substance use services is not as good as it should be, or their private insurance doesn't cover mental health or substance use at all. So again, that is a significant limiting factor for individuals. Crisis support was the next identified area of need within our community. So when asked if I or my family member were able to access needed behavioral health services in Brookings County, here's what would be different. And you can see, crisis support was among the top response rates. We've talked about services and professionals already. We'll talk about the children's services in just a minute. But again, crisis service was identified as one of the primary needs. And then again, survey participants identified areas of perceived service gaps related to mental health or substance abuse services. And again, crisis intervention services ranked high up there in the identified service gap area. So one of the things that came out of the task force initially was the development and implementation of crisis intervention team training. And this did not directly come from the task force, but members of the task force worked with key stakeholders within the community to develop and implement crisis intervention team training, which is geared at law enforcement or first responders. This is CIT is an international organization and supported through trainings across the country. Here in Brookings County, we did bring a Brookings-specific crisis intervention training, and we've had one training so far. The recommendations related to crisis support would be to continue funding and support for our CIT and the development of a mobile crisis unit, and then support for the expansion of triage services via Avera Behavioral Health. Substance abuse services, again, this was identified as a barrier in terms of lack of specific service area. So the primary response for substance abuse services came in the narrative form when we asked individuals to kind of identify what their perceived gaps were. So we pulled out a couple of the common theme quotes here around substance abuse services. I think there's a good variety of mental health services available. However, there seems to be a lack of substance abuse services, especially services for those who may need medical assistance with withdrawal. Brookings needs a detox center, needs inpatient care facility, safe room at the hospital, less jail, more mental health focus. And then identification that there's a significant amount of substance abuse happening in our school system, and again, making sure that we have the support and resources to help address the substance abuse and mental health need within the school system. So I just wanted to give a brief highlight of medication-assisted treatment. It is the use of FDA-approved medications in combination with counseling and behavioral therapies to provide a whole patient approach to treatment of substance abuse disorders. This is something that the State Division of Behavioral Health is really looking to expand that level of service to all community mental health centers across the state and ensure that this is a service that's able to be provided in our counties because it's being identified, medication-assisted treatment is being identified as a significant need across our state. So one of the recommendations would be to support our community mental health center, East Central Behavioral Health, in the implementation of medication-assisted treatment, and then ongoing discussions and support for crisis or detox beds within Brookings County. I'm going to turn it over to Deb here to touch on our school-based services.
We did have some very specific aspects of the survey that dealt with school mental health services and mental health care for our children and adolescents. And as you look at the survey, you can see overwhelmingly when they were asked in the survey to provide any additional comments, an overwhelming number of people shared major concerns over service available within our school system and to school-aged children. That was by far the largest group that responded to that question. And so that's an area of concern that all of us on our task force are concerned about, and I think everyone in our community is concerned about. Some of the things that we saw in the survey in regards to direct quotes from individuals, when they were asked in the survey to provide any additional comments, an overwhelming number of people stated major concerns over the services available in our school system, as I said earlier. And so these quotes I would like to share with you. Just as psych and counseling services in the school system are good, but they need much more support to accomplish the needs of our students. I do know of 3 families who have opted out of Brookings School District to go to smaller schools where the kids will get the services they need. Another quote was, teachers and school staff need to be adequately trained on recognizing children in need. More counselors are needed in our schools to be available for those children, and it's severely lacking, especially at the high school level. And then the schools need additional staff to meet the needs of children with mental health issues. It is difficult affording trips to Sioux Falls to get the help that's needed. cost of gas and taking time off work makes it hard to correct that help. And when you look back to the demographic data and the people that completed the survey were people that had a higher educational status. So those that have a lower educational status, it makes it even more difficult for them to access these services if they're not available in our schools. In terms of what we would like to point out, the School and Mental Health Services and Mental Health Care for Adolescents, the School Counseling Association recommends that a school counselor to student ratio be one counselor for every 250 students. The Brookings School District currently has 10.5 counselors, which gives a ratio of one counselor for every 324 students. The goal would be to have 13 school counselors and three school social workers in our school system. But of course, that requires funding. And so it is our recommendation that we hope we can provide some of that funding to increase our school mental health staff. And hopefully this data and information can help bolster community support for an opt-out to get some of those funds needed to address those concerns in our school.
So then we look at our objective of providing a venue for collaboration and communication. And so there was an opportunity in the fall for an opioid grant through DSS where a few of us really noted to look at action steps moving forward. We really needed to engage a lot more sectors in the community. And with that, we looked at creating the Brookings County Mental Health Coalition, which is a collaborative group that includes currently about 12 to 15 different organizational members. And we meet monthly and look at specific identified action plan priorities that we've created, as well as identifying objectives to get us there, timelines we're focused on, and supporting each other to move forward. So our recommendation would be specifically that the City Council, the County Commission, and the Brookings School Board identify a representative from each entity to attend that monthly coalition meeting, as because the task force is a time-sensitive committee, we still need to create some engagement and discussion around not only some of the recommendations we're talking about today, but other steps moving forward as we look to address, the top needs that we've identified, as well as some needs that we might see later on moving forward. We know that, especially when we look at those top identified needs, we need more people around the table to help with that discussion. I think the Mental Health Resource Guide is a great example where with the funding, we are allowed to list private practitioners. We have a lot of services available. The more we can provide that venue for communication, the better. The other thing coalitions allow is a lot of the larger grant funds are moving forward with having a specific requirement that you have a coalition that engages a city staff, a county staff, a school staff, that looks at having kind of that top-down engagement to ensure that you can implement that funding or implement like a community-wide action plan or strategic plan. So when we talk about creating that success moving forward, that coalition can really be a substantial option. We also look at the opportunity that the city has with creating one of the hospital board member positions with a mental health background. Having somebody as part of the hospital board who has some of that mental health insight can be a really great strength as we look at supporting the hospital with the needs that they have. Karen Weber's been fantastic as part of the coalition, as part of crisis interventions. When we look at everybody who's coming to the ER, I know she could sit up here and spout out stats that I can't give for you today, but she would definitely say that the ER handles quite a lot of mental health crisis and really helping the hospital identify ways to support that need can be a fantastic opportunity for the community moving forward.
So we just wanted to take a few minutes with the last slide here to summarize the recommendations that we provided, and then we'll open it up for discussion and questions. We've categorized our recommendations into short-term, intermediate-term, and long-term goals. So on the short term, some things that we can look at implementing hopefully quickly would be additional funding and support to the Community Mental Health Center, additional funding and support to increase school-based services, again with the goal of increasing that counselor-student ratio, having a Brookings City, County, and School Board choose a representative to attend our Mental Health Coalition monthly meetings, provide support for the expansion of triage services via Avera Behavioral Health, and then continued funding and support for the Community Mental Health Resource Guide. Our intermediate term goals, ongoing discussions with health system, law enforcement, SDSU, et cetera, again, just to continue to build on the collaborations happening with the community and ensure that we're having open dialogue and communication going forward. Using the task force data to bolster community support for an opt-out to fund additional counselors for the school system. Brookings City and County will place a board member within the Brookings Health System that has a mental health background and commitment to increase mental health care through the medical system. So again, that would be a board seat for someone with a mental health background. Continued funding and support for the crisis intervention team and the development of a mobile crisis unit. And then our long-term goals really look at kind of big picture, what can we start working on now, but will ultimately take some additional assistance, whether that be from local or state legislative actions or what have you. So the consideration of a centralized referral service, conversations about future legislative issues, conversations about licensure, which we didn't talk specifically about in the presentation, but would certainly help us address the identified need of lack of professionals in the community. There are some things that have been were proposed in this last legislative session about change in licensure status for providers. So continuing those ongoing discussions. And then ongoing discussions and consideration of a detox or potential crisis beds within the community.
And I want to add, so those long-term goals that you see there, considerations, conversations, ongoing discussions, again, that's why we're recommending that school board rep, the county commission rep, the city council rep, as far as attendance of the coalition. That is going to be the fantastic venue to host those conversations because we can have everybody at the table.
Task force members, any additional comments before we open it up?
I also want to say a copy of the Brookings County coalition plan that coalition members have identified currently will be on the Mental Health Task Force website. Stacy's going to help me put that up there. I know that was something we wanted to make sure was available to everybody. So whether you're watching this live, whether you're watching it recorded, that is something that's open to the community because, again, it's a community coalition that focuses on what the coalition members want to focus on moving forward, as well as our finalized report in the future, this presentation. There's a link to the Mental Health Resource Guide and the Lit Review. So all of those will be listed on the Mental Health Task Force website, which is on the city website. We know it's not there right now, but Stacy is going to work with us to have all of that available to anybody who wants to access that.
Okay, at this time we would open it up to any comments or questions that you all have.
I'll just kind of open it up by thanking all of you. I know how much work went into this, having served with the task force. I think the thing that amazes me more than anything else is we finally were able to bring all those data points together and come up with short, intermediate, and long-term goals. The specifics of those will have to be worked through both the city and the county, especially when you start talking about resources and funding. That's the most difficult issue that faces both those entities, in addition to the school. The school, we don't. I guess we could do opt-outs, but we haven't done any for the county for a number of years. But the school district has, and I'm not sure where we'll go that route. But all those discussions on resources come back to those three entities, And so I think if you get some specific ideas of how you want to look at that, you need to start that short term. You can't wait for intermediate or long term in order to get that going. So your coalition needs to address that first with their proper data to help us work through that process of resources. Secretary, I just had one real quick question about the mobile crisis unit that was mentioned in one of the slides. What does that look like? What is a mobile crisis unit, and is that something that it is a short-term goal or intermediate? I'm not quite sure. I see a van running around, but that's not what it is, I'm sure.
Yeah, so that really would be into kind of an intermediate or long term. I think in the short term, focusing on the work that has been done with the crisis intervention team and the crisis intervention training that we're providing to law enforcement and first responders. Mobile crisis units in every community look a little bit different based on the resources that we have available and the needs of the community. But for something like Brookings County, having designated, trained law enforcement officers that when a call comes in, the ones that are trained in mental health crisis response are the ones that are responding directly to that crisis. We have designated clinicians, mental health clinicians on hand to provide that support. And then there's a coordinated effort with the hospital. So a lot of those things are happening in some capacity. We have trained law enforcement that does an excellent job of being the first on scene and identifying specific mental health or substance use needs, and then calling in the mental health support. And certainly, partnerships with the ER. That's ultimately where a lot of these individuals end up. But again, just continuing to provide that training and the support resources so that we have a designated team of individuals that are responding to those crises. So it's hard to give, an exact picture. No, it's not a van that everyone's going to drive around in. But it's essentially enhanced training and coordination of those services so that we've got a specific team of people that are responding to those mental health crisis or substance abuse crisis in the community.
The crisis intervention team work that's kind of going on in the county right now is a wonderful example of, by the formation of this task force, we gave groups permission to start having conversations and doing something about the mental health crises that they were seeing in their span and in their individual communities. So we had interested law enforcement people that got involved, and we put together a CIT thing, and it's happening. So, some of these things, a resource guide is another thing that kind of happened. When the city, the county, and the school board gave permission to the community to say, hey, we recognize we have a problem, we're creating a conversation, we want you to start to take steps to go forward. Some of these things just began to happen. And so I think that's really an underlying thing that we haven't really talked much about, but there is pent-up demand for all of this stuff. There's lots of activity going on out there. We just got to keep fueling that fire with as much conversation and direction as we possibly can provide.
And one of those will be when we look at that short-term provide support for the expansion of triage, that flows right into that intermediate term goal of the crisis intervention. So what triage looks like, what telehealth looks like, is that within 24 hours, we can help somebody have contact with a therapist, and then that therapist helps get them into somebody at eCentral or somebody with a private practitioner or LSS or Catholic Family Services or Vera Behavioral Health, and then can see that person until they're able to get into a provider here in Brookings locally. And so I'm thankful Jason's here because Karen is phenomenal. So I'm thankful you let us have her time because Karen has been helping myself, along with Lindsay Neth, who is the head of Triage and Telehealth Services at Avera Behavioral Health, and Dr. Stanley, we continue to have conversations, and we'll be hosting a luncheon in July of how to continue to expand that service here in Brookings to help meet that crisis need.
Do you want to come up to the...
I'm Patty Bacon with the Brookings City Council, and I want to thank all of you for the time and commitment you've made and the phenomenal work you've done. First of all, to follow up on Mike's comment, I know that we as City Council are going into budgeting. We need some dollar amounts. I realize you can't be real specific, but you've got to give us some target numbers for us to even begin considering this. I mean, we're already looking at 2020, and if we can't put anything in this budget, you know, we're looking another year out. So please start putting some numbers together that would help guide us as far as the needs that you've identified. The other question I have as far as reps from County Commission, City Council, and you're saying with a mental health background, not many of us who serve on these entities have professional mental health backgrounds. I think you've had 3 wonderful individuals representing those entities, but I'm not sure I understand. Are you wanting us to recruit someone from the community with that kind of background to serve as our liaison, or do you just want to see continued representation of each of those government entities?
So we would want to see continued representation from each of those entities. When you look at a lot of those larger, like Wellmark grants, a lot of those larger grants that Brookings could potentially take advantage of, you have to have that city, county, school identified engagement. And so that's really where the benefit of those continued discussions and how those entities can support us moving forward is really fantastic. I do want to highlight quickly one number we can give you when we look at that short-term mental health resource guide goal. So United Way has graciously taken on the responsibility of overseeing that Brookings County mental health resource guide for us. That was something that we worked on and we are very proud of. We asked the city and the county for funds. They split the funds to make it happen. Moving forward, Heidi would be the one coming on behalf of United Way to ask for those annual funds. Currently, that's looking like $1,000 this upcoming year. However, of course, with inflation, it would kind of differ year to year. But that specific goal being to, fund what Heidi is requesting for that mental health resource guide expenditure.
Just to back up what Nikki said, I think part of having a person from City Council, County Commission, or School Board there at BCMHC, much like my role, and I know the County Commission and School Board's role over the last 2 years is really just to help provide insight in the process. Patty talked about asking for money. People on this task force haven't had to go through the process of making a special request for funding from the City Council. And so being able to provide that as a resource, these guys did a lot of the work. I deserve 0 credit for what you're seeing right here. But just being able to answer questions that come up along the way or make a connection is really, I think, the role that we as elected officials can play in that entity. The other piece I would say is I don't know that some of these recommendations, really most of these recommendations, necessarily are going to come with a specific dollar figure. Certainly Nikki talked about the resource guide, but I think a lot of it just comes down to being supportive. Whether it's Chief Erickson or Sheriff Stanwyck talking about providing their officers with the opportunity to take part in the CIT or get additional training. Those do come at a cost. If they're at a training, they're not patrolling the community or patrolling the county and so somebody else is, and so that might come in the form of having to pay overtime that wasn't necessarily in the budget and some of those types of things. And so it's not always going to come with the straight dollar figure. I think as elected officials, there's just times where we need to make sure that either us as elected officials or city manager or whoever it might be is saying, yes, please do those things. Please take part in those things. Do you need additional funding for training? If so, how much is that, and how much does it cost? Because they're really the experts, not anybody sitting up here with regard to things like that. And so I just think it's important to keep that in mind as well.
Good afternoon, Tim Reid, District 7, House of Representatives. Just a comment on, you've got the conversations about licensure in the long term, and as you brought up, it was discussed in the last legislature. I think as a community, we need to get that information to us and all the legislators, and that would be District 4 and 7, to make sure that that does go forward so we know what's needed from Brookings County for that. It got mirrored in a lot of politics, I think, is what really caused the problems in the last session. Several different things went wrong with trying to get that done, all the way to it came down to the last day that was being discussed, and that wasn't good. So I would somehow ask you to somehow figure out how to start those conversations now instead of consider it a long term. Another area that can be involved in is there was a grant, and I sit on the Council of Oversight for the Judicial Systems Response to those with mental illness. I think that's the name of the. I'm involved with a lot of groups that have way too long of titles, and there was conversation. I guess there was a 1-year grant to have a coordinator for CIT in the state's attorney's office. That will end, and what that group, when it last met, we're going to work to go forward with a continual funding for that position. So that's another area that we could be involved in the community and the county in pushing for that to be done when it comes to the next legislative session. So, and thank you for all the work that's been done. This will be very helpful for going forward as legislators also.
Tim, I can say, I can't speak for Bart, but I'm pretty sure Bart and I would high five you about the continuing CIT coordinator position being funded, because when we did the first round, that was a lot of work, a lot of volunteer hours that was put in. So that has been very positive moving forward to this next training, where we don't have to scramble for volunteer hours to make that happen.
This is actually my first time on a committee or a task force of this thing and of this type, and I was really uncertain about what kind of process you guys were going to put me through, and whether you could stand me or I could stand you for long enough to do any of this stuff. But what I really like about how this all came together for us is that, none of these recommendations that we're making, in my mind, are very confrontational with anybody here. They're all positive steps that Brookings can take to go forward, because we recognize as a community we have these challenges. We recognize that we need to do some things in the short term, but we also recognize we have some long-term challenges that we got to deal with. And so we should be excited and happy that we continue our conversations in the way that we're doing this, not in an adversarial kind of manner, and that I think we can come out with some real positive longer-term solutions that maybe aren't even recognized by this task force. I just, for me, this was a great experience. I applaud the city, the county, and the school board for recognizing how effective something like this can be. And if we continue the conversations, we can even be more effective than we have been.
Leanne.
I'm Leanne Pierce with the Brookings County Commission, and I wondered, as you were looking at the different services and how mental health issues are handled in Brookings County, if you looked at all at the involuntary mental health commitments or the Brookings County Mental Health Board and had any recommendations as relates to those two issues.
So we did not look specifically at involuntary commitment data or our county mental health board. It is, certainly something that kind of folds into the crisis support and crisis intervention training. When we set out the survey itself, we did not focus specifically on the involuntary commitment process, but certainly something that needs, I think, ongoing review and a coordinated effort to help address that in Brookings.
The county spends a lot of money every year on that. I mean, hundreds of thousands of dollars every year on that process. And one of the things that occurs to me is if we found a way that handled more of that here, we would save some of those dollars to do some funding here. And that's just a thought that I'd had in the past. So.
Yeah, and I think, and Nikki, please jump in here with me as well. I think certainly the involuntary commitment and crisis process, that's at the end of where we should be dealing with mental health, right? That's where it's gotten to the point where, we should have intervened long ago, so those things are not happening to individuals in the community. So, when we look at some of the goals that we do address, thinking about whether it's additional providers in the community, additional school-based services, focusing our efforts more on setting our community and our residents up for success by having those available providers to offer the services that are needed on the front end before we're responding in that crisis mode. So again, really looking at a lot of the short-term recommendations that we do have and how do we take a more proactive and preventative approach to help people in the community before it gets to that crisis point.
Thank you.
I think personally the longer-term goal that we talk about when we talk about detox and crisis beds, and we just don't have, that's a service that only allows the process that we've got in place today. And so that's a gap, and we know that. And we need more heads in the conversation to come up with those solutions and what are represented here.
And certainly something like that, when looking at expense to the county, what does the funding requirement look like for detox or crisis beds within Brookings County, and would that in fact save county dollars, being able to keep them and treat them in the very short term, as opposed to what we're doing now, which is sending them out of county because we don't have the resources here locally. So, looking at that kind of cost benefit and analyzing what it would look like financially to provide those services here.
I think it's an important part, now that you've brought up that type of financial impact on the county, to really keep in mind that some of these short-term, intermediate, and long-term goals, these are the things that we came up with as a committee, but it's also going to be important to recognize the impact that mental health and mental illness has on the community as a whole, and the financial impact of that in general. So not only is the county spending excessive amounts of dollars in terms of, transportation and all of that for individuals that need crisis, but, you're also, there's an economic impact. Employees are not able to be at their jobs. So then therefore that impacts the local businesses in our community. Students are not able to be in school. That impacts their education. These are long-term impacts that are going to affect our community members, affect the ability for us to be successful as a community as a whole. And so while these are short-term, and intermediate and long-term goals specifically related to how we work with individuals with mental health concerns and issues, the bigger impact is also something to keep in mind as we go forward. We will see the trickle-down effect as to how do we support our local community members and how do we maintain functionality as a community of Brookings and our long-term success as a whole.
And so when we hear Dan, earlier talk again about the benefits of representation at the coalition, again, the coalition provides another opportunity where we can focus on that preventative and early intervention options here for Brookings, where having a county, a city, a school board representative there, able to support us in those preventative options, we can eventually create less expense to the city, the county, and the school board moving forward. So as we talk about prevention, again, that coalition is just a fantastic way where we can look at prevention options collaboratively.
About Mike Bartley, the County Commission again. One of the things I learned a couple of months ago at the National Association of County Officials meeting in Washington, D.C., I attended about 4 different mental health committee meetings on different issues, and obviously the one on the jail was the most interesting because it costs counties all over the country millions of dollars to house people with mental health issues that probably don't need to be in jail and shouldn't be in jail, but that's the only place we can hold them, which goes back to your issue of having some sort of crisis center to put people, or detox centers. So if that comes as a result of the coalition's work, that would be great, because then it saves the county money that the county can reinvest in other things. So back to the coalition. Nationally, mental health issues are it's a spotlight issue right now all over the country. It's not just us, it's every county in the United States. Larger counties have abilities to form these coalitions and write grants. And right now there are more grants, that was reported to us, available for mental health issues, for crisis training, for crisis intervention and detox centers. The difficulty with getting those grants is getting them written and getting them submitted. And I think, Nikki, you touched on it. This coalition is a step that's necessary to get those grants put together. So I think you're ahead of the curve as far as having this task force and the results. So I would encourage your mental health coalition to, and it may be something that the city and the county has to co-fund, to have a grant writer, because there are so many grants out there. You have to identify them, then you have to pick which ones meet your needs, and then get those applications. And that's an involved process, and it's really not a process that volunteers can get accomplished in an efficient way to get the grants. So that was mentioned at the meeting, that you need to hire grant writers there that can do these things, and they are available across the country and probably right here in town, or at least in the state. So I would encourage your coalition to look at those resources very heavily, because right now it is a spotlight issue, and they're coming out of the weeds. Foundations are coming out with money all over the place. And I'll pass those on as I get them from the National Association. One of the programs I came up with, Stepping Up, is a jail program, and I've given that to Marty, and he's looked at it, and there's online through the NACO all kinds of different steps and different programs and different avenues you can look at to help with that county jail population and mental health issues. So again, I encourage you to have that coalition step forward with the grant writing possibilities as a resource, because I think it's a spotlight issue across the country, and we might as well be at the table.
And those types of ideas of presenting, the opportunity to possibly contract with a grant writer or hire, a part-time grant writer. Again, like Dan is saying, having those representatives at the coalition gives us that opportunity for a county, a city, a school representative to really help us in that discussion with these 3 entities. If I had to count how many questions Dan answered for me on different strategies to request things, I'd be counting for a long time. So again, I'm thankful that you're starting to kind of hear those things and think about them, and I really hope that's something that you guys strongly consider, is having a representative at the table.
Tim Reid, District 7 Representative. To Commissioner Pierce's question, last summer there was a access to mental health care summer study session that the legislature did. I sat on that commission. or on that interim study group. The five different task forces came out of that. 2 of the task forces are going to address what we spoke about earlier. What is acute? How should acute be handled? And then also the regionalization, or trying to get those that do have severe mental illness closer to home is going to be discussed. And so, the whole idea of, and you were right to talk about focusing on intervention. It's kind of a pyramid, upside down pyramid, and you don't want them to get down here. And so, but down here right now, we're spending so much money. So what can we do to not have as many people get down there? And then what can we do to keep them closer to home, and those kind of things? And then to start to have money and the ability to work kind of up. So I think it's really good that cities and counties are looking on the top part of it, and let the state work on the bottom part, because that's really, if they're really acute, that's where the state ends up getting involved. So hopefully coming out of those task forces this year, there'll be some significant changes in the way that we do handle the acute cases.
Hattie Bacon, City Council. I think everybody's already thinking that way, but with Leanne bringing up what the cost is now, I think visually, if you could take a look at, by providing the services that you feel we need to, how much that will save. I see Darla's here, and I used to write the grants for youth mentoring, and we could put dollar amounts to how we're saving in the mentoring program, keeping kids out of the juvenile justice system, and how many dollars that saves a community. And so I think if you can look at, if we were to do, as Tim said, the top of the pyramid coming down, I'm certain that you're going to save, especially the county, but all of us, a lot of money. So I think that would be a good way to approach looking at those dollar amounts.
That's a great point. And again, we keep tying back to the focus on the Mental Health Coalition, because it really is a great opportunity just to coordinate efforts of all of these available services. You brought up Brookings County Youth Mentoring as a significant resource to be providing to youth and help build that resiliency in our youth in the community through mentoring. The Boys and Girls Club is another great example, and the services that they provide, or working with youth going through the teen court program. So within the community, we do have a lot of some of those early intervention things in place. But again, to your point, identifying what we're doing, making sure that we're really putting the resources that are needed into those specific organizations that are focused on prevention and early intervention. And then identifying, specifically what that can save in dollar amount in the long term.
Sorry, that was a long, dramatic walk up here. Good afternoon. I'm Melissa Heerman. I'm on the Brookings School Board. Thank you so much for all of your efforts on something that hits so close to home, and something that I care about, obviously, as a school board member. And I think Deb and I feel the same amount of passion, so thank you. I have 2 questions, if you'll indulge me. The first is there any discussion around having this survey completed on maybe an annual basis? My question is, would we be able to track trends and how we're doing, or maybe would we be able to pull in a higher response rate? Just wondering if we've had any discussions around that.
Yeah, I think that's certainly something that we should think about doing, and whether that's something that comes through the coalition or as a state requirement for our community mental health center. Part of that component is a needs assessment. I think it's been a couple years, but Brookings Health did it at one point. But certainly having an ongoing way to survey the community, as we identified significant limitations in our original survey with response rate and the respondents that did come back. So trying to broaden that scope as best as possible and see if we can track trends and how we're doing. So.
I can speak, Chad would do much better than me at this, but the school district, they do the Search Institute survey, and so that is something that is definitely a goal to continue to do every 3 years. Darla, Heidi, Chad would champion that we've been selected, Brookings has been selected as a pilot community from the Search Institute to survey 4th graders through 8th graders, I believe, to survey to get some more data. The Search Institute survey that the school has done before has been middle school, high school. I'm looking at Chad to make sure I'm saying it correctly. So that's something, absolutely is on the radar to continue to do as far as the survey data to get that school age data and continue to look at objectives and how we're measuring outcomes. But adults, I think like Mary Beth is saying, I know that's something community mental health centers as part of that quality review. So collaborating together to make that data continue to be public can be something that would be very easy.
My other question is, I am appreciative that the school board will be able to have a seat at the table with the Mental Health Coalition. We aren't the only school within Brookings County. Have we already, or how can we engage our other schools to make sure that their stories are being heard and we aren't missing a piece of the pie?
That's something we haven't talked about, Melissa. That's a very good point, because we do have several schools in Brookings County that should also be at the table and be represented. But I think, the school component is so important, because if we talk about this issue of they get to the crisis point, we're at the top of that pyramid as the school district. What can we do to help those kids and deal with these issues before they become a crisis? And so, that to me is what's really important. And so it may eliminate a lot of these other issues if we can deal with that at that level. So if we could get some of those other schools on board, I think that would be great. And that is something we haven't really discussed.
If I could add a short-term, intermediate-term, and long-term goal, it would be to continue to allow Chad Adamson to continue all of his community work, because I'm so gracious the school board and the schools have allowed him to do that. He has really great relationships with other school administration and counselors in the area, and has worked with Dubrook and other local county schools where we're making those connections, offering. I know he's done a fantastic job of offering supports, engaging them when we do the parent symposiums, when we do the developmental relationships training. So if there was a recommendation sitting here thinking about it that I would add, it would be that. We're very lucky that the school board has allowed, or the school has allowed Chad to take that time to engage some of those, or offer some of those community opportunities.
Thank you.
Other questions or comments from the group?
Leanne Pierce again with County Commission. I just want to make one final remark. About 3 years ago, Counselor Hanson and Craig Paul and myself and a group of other members of the community that had family members that needed mental health services had a meeting. And I'm sure you both remember this. We sat at that meeting. People were so upset about the services available in Brookings and how things were being handled. And we said, we're going to do something that looks at this. And I just want to thank all of you for the work that you've done on this. And from what Craig's saying, we're headed in the right direction, and that group maybe would be feeling better today. So thank you all.
Again, another dramatic walk from the back. Clint Willard, school superintendent. Thanks everybody for your work. I mean, this is something that, as somebody that cares deeply about children in particular, but our community as a whole, certainly applaud your efforts and your work. It's really admirable. One of the things that I was interested where it fits in the context of your goals, we've been very fortunate to have partnered with a couple of entities at the table to provide school-based mental health services. This is really the first year that we've done it, and I think it's been fruitful. And thinking about how we can expand that service, because really it's finding ways to leverage the resources that we already have to the maximum capacity that we can, and then duplicating that model within other schools within the county. Because again, the needs aren't unique just to Brookings, they're obviously universal. And as our demographics continue to change, the needs continue to change. In a recent conversation with the Secretary of Education, he even acknowledged that much of it might even have to do with how much these are utilized by our youth. So can you talk about where that maybe fit into this discussion about some of those school-based mental health partnerships that exist and how we might expand those?
Thank you, Dr. Willert. What he was referencing, this past academic year, East Central Behavioral Health partnered with Avera Behavioral Health Outpatient Services to provide additional mental health services to our Brookings schools. So what that looks like is we have a designated provider for each one of our Brookings School District schools. That's someone that spends about a day a week in the school and works with teachers, other staff members, and sees youth as they are identified, needing services or identified by one of the teachers as needing some additional help. So this is service above and beyond the school-based counselors, again, just to provide some additional support. It's something that for several years, East Central was providing the school-based services and continued to provide services to schools throughout Brookings County, but again, identifying an increased need for services that at the time East Central did not have the capacity to fulfill that need on its own. So partnering with Avera Behavioral Health, again, just allowed us to expand some of that capacity. I think, for a kind of our pilot year doing this together, it's gone very well, and certainly demonstrates that collaboration and being able to partner with the providers that we do have in the community is going to be a benefit to everyone as a whole, because the reality is there's no single entity or organization that can meet the needs of everyone at this point. So just trying to work together to make sure that we're covering that need. And I'll let Nikki speak from her perspective too, but I think, just from hearing from our East Central clinicians that are in the schools, that one day a week that they're there is not enough. There's such a need, I think, especially at the middle school and high school level. One of our clinicians at the high school level is going several days a week and still gets called out on some crisis calls. There's just such a significant need right now that, even looking for the next academic year to be maybe expanding that service offering again to help fulfill that need within the schools, because it continues to rise. Nikki, your perspective?
I wish Chad was sitting up here. I feel like there's a microphone for you, Chad. I think with conversations with the Brookings School District, kind of what has been successful this year is identifying, like Mary Beth is saying, one entity is not going to serve everyone who is in need. I know the school district has tried to do a really good job of educating any provider if they're seeing somebody and there's a barrier, and that school-based service can be a benefit, or if that school-based service is requested, as long as they get that approval, by that school counselor, that school administration in that building, they are welcome to come and provide that service in that building. I think the missing piece is just continued conversations with other schools in the county, that there are providers who are more than happy to do that. I know there are a handful of private practitioners that I could list off the top of my head who I walk by in the middle school hallway or Camelot hallway who are very happy to help. I know we're, as far as East Central and Avera Behavioral Health, we've been able to really get into the Volga School District. That's been very successful between Amy Ward and myself. We've been able to go and offer individualized services and group-based services or crisis intervention services, and that's been really successful. So just again, that continued conversation with other schools in the area of what exists and what local providers are able to provide for them, which I think the Brookings School District continues to do a great job at.
To give another perspective on this, Dr. Willard, I teach in the Department of Counseling and Human Development at SDSU, and so I train students to be counselors. We have a large graduate program, and we do work closely with some of your counselors in your district. And so, for example, when I teach group counseling, my students run groups at Dakota Prairie Elementary, and that allows Randy Hartman more time to do other things that she needs to get done. So our students could really provide some preventative services that the school counselors are taking their time to do, whereas they could go and intervene and do more of the intervention if we have more partnership there, where our students need the hours, they need the practice, and we supervise. And so I see that as being really beneficial to the school district, and not just in Brookings, but in the area too. So I just wanted to give that other perspective as well.
And I would say that's true not only with the school counseling track, but the clinical mental health track, where this year we've been able to have interns from the SDSU clinical mental health track intern with us at Avera Behavioral Health. And we've been able to utilize not only their training, which is maybe a little different training than some of the providers have, like play therapy or sand tray therapy, and utilize those skill sets to help meet needs as well. So I highly agree with that.
This is just a side note, but in terms of the work that I do, a lot of the time we focus a lot on transition services specifically for students in the adult community, and that transition time frame is important, especially when we're looking at working with students and all of the services that surround them during the school system and how they're supported during that time often go away as soon as they're out of the school system. And so preparing our students for being able to access services after school is done, how do we notify them of who they can reach out to, how can we prepare them for what may come if they are going to post-secondary education, do we connect them to the school counseling set up there, do they need disability services, do we connect them with external community resources? So not only, in terms of education, do we need to focus on what kind of resources can we provide students during the time that they're in school, but also remembering that eventually school won't be there necessarily, and we need to be able to prepare them for how to utilize those resources when they are done. So it's a twofold process.
Any other questions or comments? Okay, we're getting close to our ending time anyway. So on behalf of our mental health task force, thank you all for being here today and participating in the conversation. A lot of great questions and discussions came out of that, and we certainly appreciate that. So thank you for taking your time with us today.